Money.
Right, we are live now.
Good afternoon. I think we can start now. We are 4 minutes late. Okay, can we have Dr. Kazi switch? There is a Dr. Kazi who has not muted.
Well, I muted her.
Okay. All right, thank you very much. We are 5 minutes away from our time. We normally start exactly at 4 o'clock. We do apologize to our viewers, but let me greet our panelists as well as all our viewers. Welcome to our weekly online platform titled The Talk with the Speaker of Council. We are on this platform every Wednesday since the beginning of lockdown. But I must indicate that October has been a very busy month for us in council. And unfortunately, due to urgent council meetings, we have been unable to schedule our regular shows for the past week or so. And we do apologize for that. But I am very happy to be back in conversation with and educating our communities. With October month being Breast Cancer Awareness Month, we believed it is important to talk about this silent killer. According to the Association for Cancer, cancer kills more people every year than AIDS. It kills more people every year than tuberculosis and malaria combined. According to the World Health Organization, breast cancer is the most common cancer among women worldwide, claiming the lives of hundreds of thousands of women each year and affecting countries at all levels of modernization. However, WHO tells us that death rates from breast cancer have been declining since about 1990, in part due to better screening and early detection, increased awareness, and continually improving treatment options. This is a very important point, ladies and gentlemen, because it speaks to the importance of regular screening and creating continuous awareness, even outside of Breast Cancer Month. So the continuous awareness, I think it has made an impact. It speaks to the fact that indeed early detection saves lives. So today I am very honored to host very important guests. I'm in conversation with the breast cancer activists and survivors about their journey with cancer. Because as we all know, it is a very difficult journey, and they are going to share us their journey. We will also look at the medical aspects of this disease, as well as the importance of early testing and treatment. It was important for me to get the voices of both young and old regarding the journey with cancer. Oftentimes, the younger people tend to think it happens to older women. Kanti cha, akunjalo. Cancer and breast cancer in particular has affected very many young people. The first guest, ladies and gentlemen, I will be introducing is a trailblazer and has received recognition from far and wide. This includes receiving an honorary doctorate in drama and film production at the Tshwane University of Technology, the National Order, the Officer of the Most Loyal Order of Ramasitsana from the Lesotho government for her contribution, not only to the arts, but also to the Sotho culture in 2016. She has received the South African Film and Television Award, phecelezi SAFTA, for Lifetime Achievement, Performance and Social Activism ngo-2011, and 2 arts awards for Best Actress 1986 and nango 1990, among others. This is in addition to the multiple acknowledgements for her selfless contribution and active involvement to improve the lives for her fellow citizens. She is also a cancer survivor. Ngokwakhe. She's an activist. Ladies and gentlemen, I am thrilled to be joined by Umama, Dr. Lillian Dube, who has been working with us even before. I remember when I was the MMC for Health Doc, for Health and Social Development. She was very instrumental in our sessions of breast cancer awareness. And she used to say to me, look at me, look how beautiful am I. I have all chronics, but look how beautiful do I look like. I am very excited to have you on this platform, Mam Lillian Dube. You are most welcome.
Ngiyabonga kakhulu. Thank you.
Refilwe Sidumedi is a young and passionate cancer survivor and activist, and is the founder of the Sidumedi Hope Foundation. Refilwe discovered a lump in her breast in August 2013, started a 7-month-long chemotherapy process in January 2014, and was declared cancer-free after a mammogram and ultrasound in August 2014. Wow, a perfect example of early detection save lives and simply following medical advice. She currently gets invited to talk to those affected, sharing her story, give hope, and in turn contribute towards demystifying all possible myths around cancer. She leads the Out of the Deep outreaches aimed at educating and empowering the youth on various issues, including surviving cancer. Sis Refilwe, you are most welcome to the show. I am also joined by my co-host and partner, Ubele, Dr. Fundile Nyati, who is also a medical doctor. Dr. Nyati, it is so good to see you. I have not seen you in a very long time because of the commitments I have alluded to earlier on. Dr. Nyati will share the medical aspect of the disease as a medical doctor. And of course, Madam Chair of Chairs, Councillor Salfina Mulauzi, who is the Chair of Chairs in the city of Johannesburg and my right hand in command. I welcome you onto this platform, Madam Chair, Salfina Mulauzi. I saw also one of the councillors from the city of Johannesburg, Councillor Zodwa Kazi. Councillor Zodwa Kazi, you are most welcome. I see you have also joined. You are welcome. With those words, I welcome all our panelists, and to our viewers, let us tune in and listen until the end so that we can also be empowered. You might be one of the people who have been diagnosed, or you have a family member who has been diagnosed, or you know one person who has been diagnosed. Today we are going to be empowered that indeed we can defeat this disease. We can be survivors. We are with survivors, with great ladies today. Maybe let me start with you, Doc, before we get into the journey of Umam Lillian Refilwe. Let's first get into the understanding of the meds. What is cancer? Ntoni cancer? Maybe breast cancer, but you can talk to cancer in general, but what is the cause? What is the treatment? What can somebody who has been diagnosed with cancer expect on a journey year recovery? Perhaps you can just kindly give us an overview, like I said, on cancer in general, but also zoom in with breast cancer. Thank you very much, Doc.
Okay. That's a problem.
Set up.
No problem, Speaker. Thank you very much for that opportunity to share. Yes, we are here today talking about breast cancer. However, there are many other types of cancers that affect people. But, you know, today in this month, the focus is on the cancer that affect the breast. Now, your question was, what is breast cancer? Well, or what is cancer in general? Now, the body is made up of cells, and cells, they form what we call a tissue, you know, and tissues form organs, and organs together become part of a body. So you've got the skin, that's a type of tissue or an organ. You've got, you know, the breast, again, there's a tissue there that forms an organ that produces milk. You've got liver, so every part of the body, the basic building block is a cell, all right? The basic building block is a cell. Now, because we are living beings, at every few days, the cells are growing at a particular pace so that the older ones, they get replaced by the new ones, and that happens throughout the body. Some parts of the body, the multiplication happens faster than other areas, but within what is normal. Now, that multiplication of cells is actually the multiplication takes place at a DNA level, which is the actual information that tells the cell what it must do, the DNA. Now, if anything goes wrong with that DNA, which is the area where information about this functioning of that cell resides, if anything goes wrong with that DNA, then the cell will multiply in a way that is disorganized. It will multiply in a way that is, you know, and it would maybe function in a way that is not supposed to be. And so, to answer your question, a cancer cell is a cell that has gone rogue. It has gone rogue. It is multiplying at a very fast rate. And in the process of that multiplication, it may not even be able to do the work it's supposed to do. And in that multiplication process, then the whole tissue becomes affected, and the whole organ may be affected, and sometimes then it may spread to nearby organs, and in some instances through blood and lymphatic system, it may spread to other organs far away. Let's say we were talking about a cancer of you know, the liver, but through the blood, then it spreads to the spinal cord, to the brain, to the lungs, you know, and all of that. But the starting problem is the fact that the cells within a particular tissue of the body, they went rogue. The DNA there was affected by something. Some of it may be something that is genetic, that is something that you got from your parents that made you to be vulnerable to that abnormality, or what we call mutation of the DNA, resulting in the cancer. In some instances, it may be exposure to other situations, you know, like maybe exposure to radiation, you know, or sometimes it may be the lifestyles that we have, where we drink a lot of alcohol, we smoke a lot, Sometimes we have a problem of obesity. So there are many risk, factors for cancer in general. But let me now focus on the one we're talking about today. Breast cancer is actually a cancer that takes place or that happens, in the cells of the breast. All right. Now, one thing to be clear about, both males and females have got breast tissue. So when we're talking of breast cancer, we are talking of a cancer that can happen whether you are a male or you are a female. All right. It is the most common cancer amongst females worldwide. Is the most common cancer amongst females worldwide. In South Africa, it is the most common cancer in females. It's responsible for 20.8% of female cancer. So 1 in 5 cancers amongst females in South Africa are as a result of breast cancer. And if we put all cancers, males and females, it is actually responsible for about 10% of all cancers, if we now not just looking at a gender. And in terms of race, the Indian population in South Africa, as per study that was done in 2011, have got the highest prevalence at about 35%, followed by the colored people at about 27%, followed by the Africans at about 21%, and then the white people at about 20%. Whilst introduction earlier, speaker, you said the incidence of cancer and the mortality is going down, in other parts of the world, especially the developed world. But in the South African context, or what they call low to middle income countries like South Africa, we are not yet seeing the reduction in the way that we are seeing elsewhere in the world. Part of it have to do with the health systems within the low and middle income countries. Now, in South Africa, specifically, you've got the rural dynamic and the urban dynamic. And the fact that 83% of South Africans, are relying in the public health system, which is challenged on its own. And also that becomes worse in the rural environments. So it becomes a little bit more difficult for people to access, the screening services, the diagnostic services, and even the treatment services. But also when we're looking at awareness programs around breast cancer, we find that most people who are doing awareness programs, they are using language that is really not accessible to the people. We talk high-powered English medical language, and a lot of people sometimes get confused. And as a result, most people don't understand the disease process that leads to the cancer, the breast cancer. I've already mentioned also that in some areas, like where I come from in the Eastern Cape, former Transkei, there is a serious lack of infrastructure and equipment. People have to move from Umtata to East London, about 3 hours away, to be able to be diagnosed and staged properly and get the necessary interventions. And that's not the only case. If you go to some parts of Limpopo and some of the rural provinces, it's a serious problem. As a result, most Black people who present with cancer in South Africa, they normally present late with cancer. All right, they present late, and by that time, sometimes treatment interventions are a problem. So those are just some of the issues, and the question that one may ask then is, how do I know that I've got, a breast cancer? Most times there will be a lump or thickening on the breast that will feel different to, from the surrounding tissues. There will be a change in the size, the shape, or appearance of the breast. And sometimes there may be what we call dimpling, where the skin of the breast looks like a peeled orange, the skin of an orange, and sometimes the nipple, which is supposed to be outside, may actually be inverted. That is, it goes inside. When you have a normal nipple and all of a sudden it goes inside, that's a bad sign. All right, it shouldn't be inverted. If you've got any peeling or scaling or crusting or flaking of the, we call it the pigmented area, around the nipple, we call it areola. If you have got those changes on the skin, you need to take care and get to a healthcare facility for you to be checked. Sometimes there may be redness of the skin, as if you have, itumba, which is a boil, where there's so much redness in that area. Now, that may also be a sign. Other people may think it's an infection. No, it may be a sign of what we call inflammatory, breast cancer. So those are the symptoms of breast cancer. So it's very, very important for women to firstly be aware of the fact that we have breast cancer as the most common cancer in this country. Number two, it's very important for women to learn what we call self-breast examination. Get in touch with knowing your breast, be a friend to your breast, know how it feels, so that when something wrong goes on, then you are able to pick it up because you are aware of your normal breast. And you should do that once a month. Usually, for those people who get regular periods, about 5 days after you've had your periods. But if you are those people who are using some of the injections so you don't get your periods regularly, then you can pick up a time and then do that, regularly. So self-breast examination. And if you pick up anything, see, somebody in a healthcare facility for what we refer to as a clinical breast examination. That is a healthcare professional who's trained in how to feel and examine breasts, examines your breasts, and if they agree, they pick up something like a lump, then you may be referred to the next level, or if you are lucky enough to have a medical aid, you may go for what we call an ultrasound, a sauna of the breast, or you can even do a mammogram, which is an X-ray of the breast. And depending on what is found there, they may even want to go further and get a piece of the area that is abnormal so that they can take it to the lab and see if indeed there is a cancer or not. And if it is diagnosed that you've got cancer, then the next thing is to find out how far has it spread. So we call that staging. Stage 1, 2, 3, 4. 0, 1, 2, 3, 4. Obviously, if it's 0, it's still localized, and 1. But if it is 4, it has gone through different parts of the body. So staging is important because treatment depends on how far it has gone. But generally, in terms of how it must be managed, surgery is the first thing that is done, or considered. Removing the tissue that may be cancerous or is cancerous, is one thing. It may just be removed that area only, or we may remove a bigger part of the breast, or remove all the breast, depending on the assessment by the breast surgeon. But also, so surgery is one possibility. Also, what we call radiotherapy, that is burning the cells, that may be cancerous. So that's radiotherapy. Also, there's something called chemotherapy, where we use tablets, very powerful, not tablets, but very powerful chemicals, or drugs rather, that may need to be put through a drip that will target these cells that are rapidly multiplying, so that they can be killed. But the only downside of that is that sometimes they may also kill other rapidly growing cells, in the body, which is why people will lose the hair, because hair are some of the cells in the body that are rapidly growing. So when people are on chemotherapy, they may lose their hair temporarily, you know. So radiotherapy, chemotherapy, surgery, there are other newer interventions like what we call immunotherapy and other types of treatment. But I think for now, that is sufficient. Now, the key message though is early detection so that you can get early appropriate treatment so that we can save lives. That is happening in the first world or developed world. But in the low to medium income countries where we are, we have a problem when it comes to that. And so us having this awareness session is actually in line with the policy framework of government, which was developed in 2017, which aims to reduce the morbidity, that is ill health, and mortality, which is deaths as a result of breast cancer. So awareness and improving access through early detection, early diagnosis, early appropriate treatment, and all of that is part of what government wants to achieve. And so by having this session, Speaker, you are actually aligning to the policy of government when it comes to how does South Africa fight breast cancer. I think let me stop at that point.
Wow, thank you very much, Doc. We are so empowered. I, for one, did not know that when you see inverted nipple, then it's also part of the symptoms. I knew other symptoms, but the inverted nipple, I was really not aware. I'm sure that the viewers are also important, but the message, after you have explained to us what is cancer and how does it develop and what are the symptoms, the key message is know your breast. Self-examination is key. You must be able to detect when there is a change on your breast as a person. I think we are early detection, very important.
Yes.
So as viewers,
one point, Speaker, then I will be quiet so that the survivors can actually share their stories. It's much more powerful to listen to those who've walked the journey than listening to a doctor. But one point, though, is that because of the fact that families, sometimes this thing can run in families. So there is that genetic connection. So if you come from a family where somebody else, like your mother, had breast cancer, then it's important that you understand that your risk is higher than the average population. And there are tests that can be done to look at whether you've got that gene, BRCA1 or BRCA2. And if you are found to have those genes that increase your risk, then there's what we call genetic counseling, and then you can sit down with your doctor and look at options. Somebody like Angelina Jolie, because her mom had breast cancer, she went and checked herself in terms of the gene, found that the gene was there, and she is now one of those people who have come up with a new way of saying, well, I'll do preventative mastectomy. That is, she went and removed her breast because she said, I'm done having children. And I know I've got a high risk of breast cancer. And then her cancer was actually, removed. So I think that's what I needed to share.
Okay, Doc. Maybe before you leave the platform, may I ask, this genetic cancer test, can it be done for other cancers as well, like the cervical cancer and that, or only?
Well, I think let's focus on breast cancer, but different cancers, some of them, there are certain tests that can be done.
Okay. Okay.
With cervical cancer, it's more around the HPV virus, the HPV, virus, human papilloma virus, that damages, it's a sexually transmitted disease that it normally causes, and it damages the cervix. And if you've got a certain type of that HPV, then it may actually make you to have a higher risk, which is why there's a vaccine for young children pre-sexual age from 9 to 13 that can be taken to actually prevent that cancer. But for now,
Thank you.
let's focus on breast cancer.
Yes. Thank you very much. Thank you very much, Doc. NgesiXhosa sithi uthethile ugqirha. The doctor has spoken. Thank you very much. Mam Lillian Dube, please take us through your journey with cancer. How did you find out that you had cancer? How did you feel after receiving the diagnosis? Because I think that's what kills many people, the depression, the anxiety and that. And how did the treatment affect your body? How and what was your darkest moment during this treatment, especially as a mother, as a grandmother, as a woman? If you can just share that, your experience with us and the viewers. Over to you, ma'am.
Thank you very much. I was diagnosed with breast cancer in 2007. In fact, I diagnosed myself, and thanks to Soul City, because you know that I used to play Sister Bettina, where I was dealing with women's health issues. And as a result, I loved what the doctor said, that you should know your body. Because this one particular morning, I was going into my bathroom and I realized that the other breast was bigger. In fact, breasts are not the same size. But when there's a problem, the other will be more bigger. And I thought, And then because I knew what to do, I started examining my breast. That was the right breast. And I felt a lump. And that lump is very tiny. I would say a pea size, not apple. So because I was in the habit of going for yearly mammograms, I went for mammogram and they told me there was nothing. But I already knew there was something. As I was just about to leave, this young radiographer said to me, Mama, please come back, because your last x-rays show there was a little dot on your right breast, but now it's grown. So she confirmed already what I knew. Then I did a biopsy, which confirmed. And then I started with surgery. I did what they call lumpectomy, after which I received chemotherapy. Thereafter, I did a radiology. And all the time, because you wanted to know how I felt. Initially, when I was diagnosed, I thought it was the end. I thought I was going to die. Thank God to Soul City and everybody, I mean, the whole nation was praying for me. And I also started praying for myself and said, dear God, please listen to your people. Because for me, it was like, there's nothing more to do. Fortunately for me, I went to Professor Carol N. Ben, who is a very lovely doctor, who told me, no, I've got nothing to worry about. She didn't make me panic. And also, I started joining a support group even before my surgery. But what amazed me at Dr. Carol Ben's offices, I saw these aliens. Everybody had a cheese cup. I didn't realize that that's what chemo does. But because the support group held me by the hand, I had faith. Some showed me that they didn't have breasts, but they were still alive. So I was filled with hope, and I felt I was in safe hands. The oncologist, Dr. Carol Ellen Ben's team, in fact, all the oncologists and nurses in oncology, they are such caring people, and I can never thank them enough because they are very dedicated. My only problem is that if you do not have a medical aid and you go to public hospitals, they will tell you you've got cancer, you must come in 6 months' time. In the meantime, the cancer is growing. You come back in 6 months' time, the machine is broken. So, doctor, please, and in our counselor, talk to our government, really, because the doctors are doing their best without the machines, and that's what kills people also. Remember, that was in 2008, my first cancer, where I did a lumpectomy. 8 years later, the cancer came back on the same breast. And I was very surprised to hear this year by Dr. Carol and Ben that it's very unusual. And thank God, the second cancer now was not the same one, but on the same breast. Now, this one needed a very expensive treatment, which is called Herceptin. My medical aid was depleted, and I had to pay R500,000 for this second cancer. And that really upset me because they were younger women with little children who don't even have medical aid, who have the same cancer, and they're given chemo, and it doesn't address their cancer, and they die. So I joined Doctors Without Borders. I went to the then Minister of Health, Dr. Aaron Motsoaledi, to say, please make Herceptin available in public hospitals, because yes, indeed, it is expensive, but not everybody not every woman has the same cancer. So please, I'm proud to tell you now in some hospitals like Charlotte Maxeke, you can access Herceptin, but we need to do more. So I would say to people, in fact, let's say when I was diagnosed with cancer, I said, God, if you spare me, I am going to create awareness. Because like you said, early detection and early treatment does save lives. Cancer need not be a death sentence. And I urge people to have support groups because you cannot do it alone. That is why I joined support groups. And I remember when we started, we used to go on a journey we called the Journey of Hope, where we were sponsored by bikes, Harley Davidson, Triumph, and other motorbikes, where we educate people from Soweto to Cape Town, stopping in every dorpy to create awareness. Like I said, the doctor said, know your body, it's very important. Are you still there? Can you hear me?
Yes, yes, we can hear you, Mama. We are still there.
Yes, I'm saying it is indeed very important for everyone to know their bodies. Now, I want to ask the doctor, my mother died of cervical cancer. Is there any relationship between cervical and breast?
All right, let me try and answer that. In terms of the literature to date, Mama, we we have not picked up the commonality between the two. That is cervical cancer and breast cancer. But before the end of the show, I'll just give you more information. But for now, of the information that I have, as I answer you, there is no connection between the two. However, the fact that there was a cancer before, the generation just above yours, one says then there's a higher chance that you may have cancer, but not necessarily the same that the other one had.
Thank you, doctor.
Okay. What, are you done, Mama?
Yes, she's done. She's done.
I am. Thank you.
All right. Thank you very much. What I take from you is the importance of awareness. Awareness to save lives. Once you are diagnosed, support group, don't be alone. Join the support groups. Don't be alone. Share experiences with other people. And what I like is that you are assuring the viewers that cancer is not a death sentence. It is how you take it and how you behave after you've been diagnosed. Thank you very much for sharing your experience with us.
Can I point out one big mistake? In our Black community, cancer is still taboo. There are a lot of women who've died without revealing that they've got cancer. Even when they talk about cancer, cancer, as if the cancer will hear them. It's not, it shouldn't have a stigma.
Oh, yes.
Yes,
Oh,
please.
yes.
Because
Oh,
most, they only go when it's too late to be saved.
Yes, yes.
Yes, because it's amazing how when you've got cancer, abantu bazothi ngumthakathi.
Yes. So it
Yeah.
means, yeah, I think awareness is very important to educate also those people who are not necessarily diagnosed, but those who are supposed to give support to those who are diagnosed. And
Yeah.
also, and also to deal with the stigma. Thank you very much, Mam Lillian. We really appreciate. Sister Refilwe, most people believe that cancer is for older people. Ukuthi hayi into yabantu abadala le ayiyonto yabantu abancinci, ayiso sifo sabantu abancinci. You were quite young when you were diagnosed with cancer. Please take us through your journey with cancer. How did you find out that you had it? How did you feel after receiving diagnosis? I think the same question I've asked Umama. And how did the treatment affect your body? And also, how did the treatment disorganize you as a young person, as a young woman who would want to go out there and enjoy and that? How did it really disorganize your way of living? And what were your darkest moments during the treatment? Over to you, Sis Refi. Unmute her, Sister Refilwe.
Okay, all right. Can you hear me now?
Yes, we can hear you now, Refi.
All right, thanks, Ma. I was diagnosed in 2013, in August, and with the history in the family, because I lost my mom in 2004. She had brain tumor. Like doctor was saying, the generation, you know, when there's a history, we must always, we must know that we at high risk, you know, and the upcoming generation. So for me, it was being a single mom, it was so hard because my son was 12 and my daughter was 6. So on my way to, because I went to see the doctor, I had a lump in my left breast, which was like a size of a grape. And I had it for 2 to 3 years, which I don't condone to viewers at home, because it's something that is, I can say it's a fear of the unknown, you know, like thinking I lost my mom due to cancer. So obviously I'm gonna die, you know, and I seriously don't condone that. Like we keep on raising awareness that you must know your body. It took me a while, you know, to go and get it checked. And I went to see my normal general practitioner. She said to me, when she started examining me, she said, lift up your arms. I'm like, what does lifting up my arms have to do with the lump in my breast? Because I'm here for the breast. Little did I know that there are things that doctor was saying, the lymph nodes, and I didn't know anything about that. I was just shocked when she was just examining me, and then she was busy drawing a sketch. Then she said to me, this doesn't look good. I'll refer you to Helen Joseph Breast Clinic, where Professor Carol Ben is based, and that's where my journey started. And I did the mammogram, I did the ultrasound, and you know, the waiting also is something that is really also quite depressing. You know, you're waiting for the result and thinking, I hope they're gonna come back negative, you know. And one thing that I also want to emphasize is some of the lumps are not cancerous, but doctors always emphasize that we must remove those lumps because in the near future they can be cancerous. So I was diagnosed with stage 2 of breast cancer, and I still remember when I was frustrated, crying and all that, like Mom Lillian was saying, the support groups, there are ladies there that went through the same journey, and they said to me, you know what, you're not gonna die, because the only thing that comes through your mind is, am I gonna die, you know? And like we saying that the taboo, we always think cancer is a white man's disease, you know, especially as Black communities, which I don't want people to take an offense, but it's reality that we're looking at this thing like it's a white person's disease. If I'm a Black person, it's either I'm bewitched or it's a curse. There's nothing like that. But again, our beliefs, you know, how we believe in, like we believe in different things. And it really broke me. I was shattered, and I had a suicidal. I actually thought of committing suicide on my way back from hospital. I just wanted to drive in front of this truck and just take my life like that. But I felt there was just a voice that came through to my ears and said, "No, you've got so much to live for." But you know, the devil was also whispering this thing of, "No, do it," you know. And I'm grateful because I didn't do it. And I listened to the other voice that said to me, "No, you've got so much to live for." And that's how my journey started. I had to go through, they did the first surgery to remove the lymph nodes. And we waited for the biopsy, and then the results came back. Then they said to me, "We're going to have to do a surgery, which is the major one, to remove the lump and do reconstruction of both my breasts." So I've got scars on top of my nipples going underneath my armpits. And after that, I had to go through chemotherapy, 7 months of chemotherapy. After every 21 days, I had to go to hospital for my chemo, which was very horrible. There's the one that they call the red devil. I was just skeptical about, why do you guys call it the red devil? Because I believe, why can't we call it the blood of Jesus, you know, that it's washing away all these cancer cells. And I lost so much weight. I used to get very, very sick. Like while they're busy with the chemo, I'll vomit. I used to vomit for 3 to 4 days without eating anything. I lost so much weight. I was so dark in complexion. My hands were dark, my nails were dark, my tongue was dark, and my teeth, they shifted, they moved. And I used to have mouth sores. And for me, the white cells and the red cells used to drop. So sometimes when I go back, then they'll say, "We're not going to give you," because they'll draw blood. And then they'll say, "No, we're not going to give you chemo." They'll give me injections to inject myself in my tummy, on my tummy for 5 days, and then reboost the white cells, which was like, it was just, for me, it was like, it's really taking me back 10 steps backwards, because now I'm hoping to finish this thing quicker. 12 days after my first chemo, I lost my hair. I still remember how I lost my hair. I had a weave, and one morning I was trying to fix my weave on my way to work, and my hair was like, that weave was just coming out. It was just coming off, like as if I didn't plait my hair. And I screamed, and I said to my kids, my hair is falling off. And my son just gave me a hug and said, "Mommy, please promise me you're not gonna cry." And I was about to cry. You know, as women, we believe that our hair defines us, which is something that I guess we look at ourselves and we see as very beautiful with our beautiful hair or braids or weaves. And you know, I said to myself, I'm not gonna wear any wig. I'm gonna embrace this journey. Every time when I look at myself in the mirror with my bald hair, I would say to myself, I'm not gonna allow this cancer to dictate me, you know. But it was really tough. I don't want to lie, it was really tough going through all the needles, the journey. And then after my chemotherapy, I had to go for mammogram, so that they will tell me if I'm gonna go for radiation or not. I went for mammogram, and the results came back that the cancer was gone. But I still had to go through the radiation, 6 weeks of radiation every day, Monday to Friday at Charlotte Macrae, yeah. And radiation was not that bad. It's just that you'll feel a bit tired, dizzy, and all that. With chemo, you get sick. I remember I was once involved in an accident because I used to drive myself. And I was involved in an accident when I was going through chemo. That's when I was with First for Women. That's when they said, "No, Guardian Angel will just, they will come and pick me up
I'm sorry.
It was just quite a journey, which was really rough. And one thing that I can say is accepting, if there's a situation that you're facing, to accept and try to deal, how do I face this? Because if you're going to feel sorry for yourself, then it's not going to help. Pity party is not going to help you, because with cancer, it's either you live or you die. And I'm telling you, some of the people would not come back for their chemo because they got very sick. And if you don't come back, then the cancer starts spreading, because now the chemo is aggressive. Now the cancer becomes more aggressive. And which I couldn't blame them, because that treatment really messes your body. It messes it up. And I'm telling you, even now, early menopause, at my early age, I'll have hot flashes, and people will look at me like I'm sick. Why are you? And then I'll have a hand fan and I'll go like this. They'll go like, are you feeling hot? Why? You're still so young. They don't understand what I went through. They don't know what I went through. And to be quite honest with you, cancer is just something that is, if you're not gonna fight with everything that you have, you're not gonna make it. And again, one thing that I can say is our families, as much as they don't know how to deal with us, they must always accompany us to the support groups so that they know more, because doctors are always there. But some of the people don't really talk, like Mama was saying. People just die in silence, and talking helps, because you don't know when you're talking, someone is listening and went through the same thing. And then they will tell you, no, I this is how I managed to pull through. And my stubborn faith really helped me. Prayer conquers everything. And my church leaders and my church members, they were there. Every time when I was feeling down and couldn't wake up, I'll just send them messages. Please pray with me. Like Mama Lillian was saying that we were praying with her. And God listens. God will never give you something that you won't be able to handle. We when we're going through challenges, we're going through trials and tribulations, we think He's the end of the world. No, it's not. We've got so much to live for. We need to know our purpose in life. What is it? Why am I here? And I'm grateful that I made it up until this far, because I'm now 7 years on remission. And I'm grateful. God is good. God is great. And if it was not for Him, His grace, I don't think I was gonna be able to be talking to you guys now, And I always say when I do my talks that most of the time we're thinking we are cursed, we are bewitched, and all that. No. You can do that and whatever that He will give you, but you still need to go to the doctors, because sometimes you stay with that and the cancer spread. And then by the time you go to the doctor or hospital, now everything is a mess. All your organs are affected by cancer, So I always emphasize that you are not alone. Giving up is not an option. No matter what you're facing, you can't give up now. You've got so much to live for. You must fight with everything that you have. Yes, we fall down, we pick up the pieces and we move on, because a better version of you is waiting on the other side, So those darkest moments was when I was really so sick and thinking. I remember my third chemo, I thought I was gonna die. I was lying in the bathroom, I couldn't stand up. My kids, I heard my kids whispering, my daughter asking my son, is mommy gonna die? Then that broke me, that my kids are worried that I'm gonna die. So I had to fight, for my kids. I had to fight with everything that I had. And I'm so proud of myself that I managed to do it, and I'm still here, and I'm grateful.
Wow. Yeah, thank you very much, Refilwe, for sharing that journey. Yeah, painful journey, but I must say you look gorgeous.
Thank you so much, Ma.
So good. And
Thank you.
I like when you said you, as a person facing difficulties, you need to know your purpose. And knowing your purpose will give you courage to face whatever the challenges you are faced with as a human being. And you also repeating what Ma'am Lillian said, that support is very important. Join support groups. Umuntu ngabantu. Because most people, they don't want to talk and they die in silence. So really, we really appreciate. Maybe let me ask Sipho to take us through comments, and I'm sure many people are really touched by this contribution and this education and this awareness. Sipho, if you could just tell us what our viewers are saying.
Okay, madam. Thank you very much, and thank you very much to Bomme for sharing those, those very sad stories, but they are so strong and it's admirable. And thank you for sharing. So, comments on Facebook. Matladi Maguna says, "I am a breast cancer survivor, and my oncologist has put me on a tamoxifen to prevent the reoccurrence of breast cancer. But my fear is that tamoxifen has the potential to cause cervical cancer. Can the doctor please touch a little bit on this?" And then there was a message from Cornel Viljoen. He seems to have a son who's 8-year-old who has cancer, but he's not really saying much about the son. And then there was group chat. Let's look at the group chat. There's also some messages that are coming out from there. And then one from Bishop Duma says, "Cancer can be beaten. Asingobeni cancer. Siyabonga our speaker for such powerful awareness." Madam, I'm just looking at other, the rest of it's just people just appreciating, liking, sharing, because the stories that are being shared here are just so phenomenal, how the two ladies have survived this. So that's it from my side, Madam Speaker. Thank you.
Thank you very much. Thank you very much, Sipho. Let me hear from people who are on the platform, because they might also want to say a word or two or seek some advice. I have Zodwa Kazi, Wandile, and I have Chair of Chairs. Please make me aware if you are on the group and you would, here on the platform, and you would want to.
Councillor
Mlauzi. Yes, ma'am.
Thank you very much, Madam Speaker, for another wonderful program that you brought to the citizens of Johannesburg. Madam Speaker, you know, listening to the two ladies makes me very proud of them. I know they are very good motivational speakers. And Refilwe, I have listened to her. She's always in deep slot doing all those awarenesses. She's very good at it. And when she starts to organize something, it always becomes very successful.
Thank
and
you,
after listening to her, yes, my child, after listening to her, you go out of that event or meeting only very, very, very empowered, and you end up having courage to a cancer, even though I can be a positive of cancer, I will survive, because she gives you that hope which you can survive. And you know, I have learned quite a number of things that I did not know. I just know what cancer you must be, you check your lumps and all those. Those are the things that you will find on pamphlets and all those things. And when people talk about it, I just wanted to, for the sake of even our listeners, to say to Dr. Nyati, Doctor, how often does one have to test for Elon? does do breast cancer to check for any lumps in your breast. And about reoccurrence, I heard Mom Lillian talking about there was a reoccurrence of the cancer, but it was a different type of a cancer. And I was really worried about it because I was asking myself, when you are healed, are you then healed forever? So I now realize that even though you can be healed, there is a possibility somewhere, somehow, that it can reoccur. But after all this, I have learned a lot, Madam Speaker, and thank you very much to Ma'am Vivian. Thank you very much for having really given us the opportunity and making sure that we understand more of and what we should do. Awarenesses. And I think together with the speaker and all of you, we will support whatever programs that are coming out. Thank you very much, Madam Speaker. Let me give to other people to talk.
Thank you very much, Chair of Chairs. I don't see any other person who would want to ask a question. I don't want to deny people who are here.
My hand up, Speaker.
Okay, all right. Thank you, Mekazi.
Yeah, thank you very much, Speaker, for the program. This program is very important to us, though we are still have some wounds, because I lost my sister last year who had a brain tumor. And she was admitted almost every year, but they couldn't even see a thing until up to the last minute. That has caused damage. So this awareness, I think it needs to talk to the people, especially the nurses and the doctors at hospitals. As Mam Lillian has indicated to say, in our townships, that's where the problem is. Sometimes people, they want to come out and maybe they don't even get help because they have to get, if you don't have a medical aid, or maybe you'll have a challenge to be helped. That's the main thing. But this awareness is very important because I have learned more from the doctor and the courage from the survivors. I'm a bit healed. Thank you very much. I think I can pause there.
Thank you very much. Thank you very much, Ms. Otwakazi, for your contribution, and condolences again for having lost your sister. Doc, there was a question from, before I give the two ladies to comment, there was a question from the first viewer who is asking who has the fear, if you can address her fear that maybe the cancer she could get a recurrence from the treatment she is using.
Yeah. All right. Thank you, Speaker. If I remember very well, the viewer was talking about a drug that's called tamoxifen.
Yes.
Right? Now, tamoxifen, it's basically a drug, that is used either for people who have got a high risk of breast cancer, like family history, or people after they have had, a cancer treatment. Now, some of the people, because there's different types of breast cancers, and they behave differently. And now there are those that respond to the female hormone, that is estrogen. There's a female hormone or female chemical that's called estrogen. So some people, the type of cancer they have may have a receptor, a point of attachment by that hormone called estrogen. So for those people, if we find that they are either high risk or they have what we call receptor positive, that is, they've got the receptor for the female hormone, we then give them a drug that blocks that receptor so that the female hormones do not create a situation of worsening and bringing the cancer back, or if you were high risk, then bring the cancer as well. So that's the drug called tamoxifen. Now, it has, like all drugs, it has got a number of side effects. And some of the side effects, or one of the side effects, is that it may increase one's risk of cancer of the womb, cancer of the lining of the womb, which we call endometrial cancer. So that's what this person was talking about. It's not cervical cancer, it's endometrial cancer, cancer of the lining. So we're trying to solve one problem on the other side, but then you have a problem on the other side. So that is the problem. But also, some people may have a problem. If you are a person who's suffered from clots, if you are a person who has suffered from heart attacks or strokes, again, we don't like to prescribe this drug because it may have a tendency of making one's blood to clot easily, which then for somebody with a history of heart attack or strokes, it may create a problem. So that is the answer there. There was a question that was asked by chair of chairs, Umulauzi, about the frequency. Now, different cancer associations, you know, in America and in South Africa, from time to time, they change their recommendations. But in general, I would say once a year mammogram is, you know, even Umamu Lilian did say that she was used to doing once a year, which is why the radiographer was able to say, but from last year's report, this is what I picked up. So once a year is the rule of thumb. However, your doctor will advise you, because in some instances, they may even say once in 2 years, you know. So listen to your doctor once a year, you know, and if the risk is still minimal, you know, then they may even say once in 2 years. So rule of thumb, once a year.
Okay. Okay, thank you very much. There is one of the viewers, I think she's got my number. I don't have her name or her number. She writes, Somlomo angikwazi ukukhomenta or to ask questions. She is streaming live on Facebook. She says, I am also a cancer survivor for 5 years. Ngiyabonga nge-topic. Unfortunately, I don't have her name because I don't have her number on my contacts. May I give maybe to Lillian? No, Mam Lillian. I wanted to say Refilwe, but Mam Lillian Dube, just to comment on the comments from the viewers.
Thank you very much. I just want to say it is very, very important. I'm stressing again, like the doctor has just said, to go for yearly mammograms, because they'll be able to compare. But like the doctor said, it is your doctor who will tell you. But with me, in my case, even the very second cancer, I knew because I could feel things. And when I phoned my oncologist, she said, no, you are due in October. I said, no, I'm due right now. It was in August. And indeed, there it was. So it is very important to go for yearly mammograms. And also, I had the doctor say 5 days after your period. And I am glad I've learned something, because whenever I give talks, I always say 7 days after. So I'm glad to now know it's 5 days after your period, because that is very important, because otherwise you'll get wrong results if you test during menstruation. And you've said something very powerful. Attitude is everything. And Refilwe here, really at her age, I am so touched. Refilwe, I'm so proud of you, my child. I'm really proud and happy for you. There's power in prayer, but we also have to do our bit. And take away the fear, because really once you fear, the fear is the thing of the devil. That's when you die. I was angry. You know how it starts. You begin, you are in denial, and then comes acceptance. And today, Nongeba, if you ask me, for me, having cancer was a blessing to me. After cancer, it's like you don't sweat the small stuff. You're just grateful to be alive. And all the time, you want to do good. You want to help other people. So there are so many positives about having cancer if you accept it, like Refilwe said. So accept the things that you cannot change, but there's light at the end of the tunnel, and then life is more beautiful. You get to know so many people. Like I told you earlier, that I'm from a golf lunch in Branston.
Yes.
Yes. And just helping other people makes us happy. And if you are happy, you live longer.
Thank you very much, Mam Lillian. Okay, the person who wrote me a message is Councillor Nkwenkwana. Councillor Nkwenkwana is a survivor for 5 years. Congratulations, Councillor. Mam Lillian is saying, take charge of your health. When the doctor said to you, you are not due now, your appointment is in October, and you insisted, you said now, no, it's now. So that is taking charge of your health, because you are the one who seek assistance, not the doctor or the nurse. And you said no now, not in a month or two later. Take charge. I think that's very important. Refilwe?
Thank you so much, Mom Lillian. I really appreciate that, and thank you so much. It's it's such a great honor, and living every day when you wake up, you just go like, wow, I made it this morning, and you want to embrace your life, because going through what we went through, it changes how we look at life now. The whole perspective now, it's completely different. And like Mama was saying, we sleep peacefully knowing that I made a difference, and I touched lives, and it's quite a very, it's something that you take it with you and say, even if it means you spoke to one person and one day they come back to you and say, if it was not for you, I don't think I was gonna make it. And I wanna say, with me, I'm my pink look every day. I never get my hair any color. For me, it's like saying to people that there is life after cancer, and for you to be here, there is a meaning with your life. And go out there, touch lives. Don't worry about what people say. They don't know your story, because there's nothing written in your forehead. And we mustn't allow any situation to dictate us, to define who we are. We must take charge, like Mama is saying. We must take charge and say, I'm not gonna let this situation dictate who I am. There's always light at the end of the tunnel. Right now, when you're facing a difficult situation, you're thinking, how am I gonna get out of the situation? But God is there. Angels are there with you all the way, and you will make it. And I'm really grateful that I made it this far. And when you go through this mountain called cancer, or any other situation, or any other disease, and you pull through, you become very grateful, and every day means a lot. Every second, every minute, every moment, you embrace it. And people don't understand. When you live in your life to the fullest, they don't understand, because you went through so much. And life is very, like, who said life is going to be easy anyway? We face challenges every day, especially as women. I just want to touch on that. As women, we need to be supportive. We need to be there for each other. We must just stop this pull down syndrome. We must not allow other people to come and fix our crowns, or making noise that, oh, Mom Lillian, your crown is crooked. I must fix it silently, and without anyone noticing, because that's women power. We must be there for each other. stop this gossiping or laughing about each other, or when someone is going through something and we just poking or making things worse. We must just be there, embrace each other, be supportive, empower each other, you know, and I believe we can take this world by storm, you know, as women, you know, and nothing beats a woman who knows that if I'm surrounded by powerful women, I'll also be powerful, you know. And one last thing that I want to say to viewers at home is, being diagnosed with anything, it doesn't mean it's the end of the world for you. It actually changes how you look at life. And now you've got a mountain in front of you. You have to go through this mountain and go on the other side. That mountain is not as hard or is not as difficult as you think it is. We are much stronger than we think we are.
Wow. Wow, thank you very much, Refilwe. Thank you so much. Doing good is the way to go. Be each other's keeper, especially as women. Be each other's keeper. Support each other. Don't laugh at each other. Don't enjoy when somebody else is going through tough times, but support. Ubuntu. Because that is Ubuntu. Let us bring back Ubuntu ebantwini. Thank you so much. Thank you very much. Let me, before we close, we will be closing the show at 5:30. Let me get Sipho to tell us what are the viewers saying.
Madam, just this very important one that Matladi Magunda has responded, saying that thank you so much for the platform, and the doctor's response was very helpful and clarified some questions, but I agree that we need more education. So that's it from my side, madam.
Okay, thank you very much. Doc,
Mama?
All right, who's that?
I actually wanted to say
Yes,
something
sorry.
about tamoxifen.
Yes.
The other lady was asking about tamoxifen. I
Yes.
was also on tamoxifen, which, like she said, it will, for the cancer, it prevent the cancer not to be okay. But I'm gonna share this because I saw soldiers going through that and cancer reoccurring, and they passed on, you know, and it becomes alarming, you know, that what now? If I'm taking this medication, which was for 5 years now, 10 years now, they moved it to 10 years. And while you're busy taking the medication, then the cancer comes back, and it comes back aggressive, more aggressive than before. Then it's something that I don't know how because now as a patient, you feel like you don't know what to believe anymore, you know, and it does have side effects whereby you just, like early menopause, like you just have these hot flashes. It doesn't really, you know, it's something that it's frustrating. So I don't know if doctor or I don't know, but we just need to know more about this medicine, the medications that they're giving us. Sometimes it's good, sometimes it's bad, you know, and you just get frustrated. How do you deal with it when they just say, okay, now you're gonna be on tamoxifen because I was also on Zodalex, which was for 2 years. It used to make me very sick. But then they'll say, no, you have to take it, you know. And some people doesn't take it anymore. They feel that it seems like it's making us feel sick, and now the cancer comes back more aggressive. What do you do? So it's something that is quite, I understand where the viewer is coming from, because we always, when we there, we always talk about these things and get frustrated. And, you know, doctors, sometimes they don't really give you a straight answer, you know. So you get frustrated, doctor. We get so frustrated, and you feel like, oh my word. So where do I go to now? You know, because I'm expecting that when I'm with my oncologist, they must be as honest as possible, you know, and give me the disadvantages and the advantages of the medication, so that I'll be the one who says, no, this one I'll go for it. This one I think I don't want to go for this one. You get what I'm saying? So yeah, it's sometimes quite frustrating.
Yeah, thank you very much, Doc.
Yeah.
Because you are on this platform, may you please give a straight answer?
No, I have already, but
So
just
and also wrap up, Doc. Then I will also allow other panelists to wrap up.
I think we cannot finish without Uma Mutube talking about partners feeling each other. She's got a way of putting this thing, some people, the lumps are actually discovered by their partners. Their partners are much more in touch with how the breasts of their people are feeling. In return, they also get to do some screening of certain pathologies. So I would like it I would like her to say it herself, but the answer to Uri Filwe is that it is possible to actually have, there's many different types of the cancers, breast cancers. Sometimes, like Uma Mulilian said, the first one was sorted out, and then the second one that came was a different type of cancer. All right, and so because it could be cells from the ducts are where the milk is produced, or it could be cells from the tissues that support the milk producing cell. So sometimes, although it's rare, but it can happen that whilst the other one was removed, then you get another one that is different from the first one. And that one may not necessarily be an estrogen a sensitive one, which was supposed to have been prevented by tamoxifen. It may be a different type. So I think I wanted to answer that to say it's not like the tamoxifen failed, but it's likely that you had a different type of a breast cancer, and that could be the reason. I can't remember now. There was another a question there. All right. There's something that was mentioned also by Refilwe, importance of spirituality. When you go through difficult times, when you go through difficult times, sometimes it's a way of bringing you closer to your creator, in terms of the relationship. And obviously, as medical people, we don't focus a lot on this part. However, I'm a family physician, and in the space of medicine that I'm in, we talk holistic management of patients, which is biopsychosocial spiritual. Okay, the spiritual component is very important because it helps in terms of people getting hope. It helps in terms of person and getting meaning from life. It helps with resilience. It helps with people getting to accept, knowing that there's this other power that is actually working with them, through the journey. So I can't emphasize that enough. Most people in my practice, when I used to, practice every day, when I have to break bad news, bad medical news, I would first want to understand their spiritual grounding and be able to give them the bad news and strengthen them in line with their spiritual grounding, because that's where, even if you think the problem is beyond you, but you get strength. We don't talk a lot about that as medical doctors, but research that's coming from other parts of the world is starting to show that we must include spirituality, in the total management of patients, and be non-judgmental, in the process of doing so. So I thought I needed to just emphasize that the issue of stigma, it's a big problem, Mamu Tube, as you know, but it's important that we break that stigma. And by the way, the very people who are stigmatizing others don't know their health status, you know, and it could be them tomorrow. So by creating platforms like this where we share information, you share your story, there's nothing as powerful as storytelling in the African context from an awareness creation, which is why it's so important to have the two people who have survived. So, Speaker, this has been a very, very good way of educating people around issues of breast cancer. But we won't finish before Mamutube. It means I must extend for a few minutes. She must. There's something that she has to say.
Thank you very much, Doc. And I saw Sipho's smile that he's looking forward to hear Mamutube Teta Ngongo go feeling each other.
Yes.
Partners feeling each other.
Please, in case you haven't seen, tonight at 8:30, watch Gather Cliff's show on ENCA.
Okay.
Did you hear that?
Yeah.
At 8:30, ENCA, Gather Cliff's show. I'll be speaking there tonight.
Yes, you can start here though.
I pledge, gentlemen, to suck those titties. And ladies, to rub those bolekis gently, because the men came back to me to say, when you squeeze them, they are painful. But the beautiful thing is, when you touch those bolekis and your man says, "Eina or Ichu," then you know there's testicular cancer. And when I say men must suck those titties, because a lot of men have saved their partners' lives. Because if you're in the habit of sucking those titties, when there's a lump, you are the first one to pick it up. Thank you very much, Doctor. I am glad you listened.
Wow, thank you very much. Oh, I'm tempted to clap hands. Thank you very much. Thank you so much.
Thank you.
What a wrap up. Refilwe, just
okay, I'm glad. I'm very glad, Mom, because I was gonna say she must say that, because I know that one she will never leave. Doing a talk, there was no way that she won't say that, and I was also waiting for that. Thank you, Doctor, for that. All I want to say to our viewers is, when you're going through trials and tribulations or challenges of life, thinking it's a mess, allow God to use that mess and turn it into a message, so that you can go and share your story and make a difference and change other people's lives through your experience. And you are not alone. We are here for you. You know, we are not far. We are just phone call away. And, you know, life is not easy, but every morning when we wake up, we just have to thank God that we made it, and we must just be grateful. So yeah, cancer is not a death sentence.
No.
Early detection will save your life.
Oh, thank you so much.
Do your exercises, eat healthy, stop smoking, alcohol, just, you know, a little bit, you know. So those are some of the things that we need to look into, and take your life very serious. That body carries you through every day, so you must take care of it. Drink water and all that. So yeah, thank you so much for having. It was such a powerful experience, and thank you so much to everyone. Mama, I really appreciate you, and I'm so proud of you that you managed to beat this monster more than once. And Mama, I'm grateful. Thank you so much for having us. It's such an honor. Doctor, thank you so much. I've learned a lot. Like Mama was saying, we knew that it's 7 days, but now you said 5 days. So I didn't know it was 7 days for me. So I've learned so much, and I really appreciate everyone. Mama Salpina, thank you so much.
Thank you. Thank you very much. There are a few comments, and Wabisa says, very insightful and necessary topic. Sipho, I knew that Sipho will really appreciate Mama's last input discussion. Says awesome discussions. Hey, Mam Lillian. Indeed, I want to echo the same sentiments as Bishop Duma. Othe, cancer can be beaten. Indeed, cancer can be beaten. Asingqoleni cancer. Doc, I see your hand.
Yeah. No, just one little point to the males this time.
Yeah.
Breast cancer is non-sexist, meaning it also affects males as well. Maybe not to the same frequency, but it also affects males. In the thing I read, for every 396 women who've got breast cancer, then there's one male who gets cancer. But the point is, males do get cancer as well. And so if you have a lump and you are a male or something changes, inverted thingy, go seek help in the same way we had advised the ladies to go and seek help. Don't sit with changes in your breast area and just think because you are a male, you can't have a breast cancer.
Thank you very much, Doc. Males, please do your checkups as well. I know males don't like checkups that much. So males, do your checkups as well. Thank you very much. You know, Mam Lillian Dube Norifilwe, you have made me to appreciate life from today. And I think that's what we need to do as human beings, is to appreciate life and appreciate days that God has given us. Thank you very much. Thank you very much, Doc, for your education, your information. We are medical practitioners as well today. We know it's not 7 days, but it's 5 days. And we know the symptoms. We are more empowered. Thank you so much. My colleague and my second in charge, Councillor Mulauzi, thank you very much, and thank you very much for your input. You and Refilwe, please invite me, Manisekasi. I have attended, I think, one or two of your sessions, Refilwe, so I will be invited. Doc, I have already said thank you so much. You are our lifetime partner. Mamudube, we appreciate you. May God give you many.
On the 31st of October, we are doing the walk.
Okay.
The walk. So go to Justin Itemba Walkathon into their website. You can walk from the comfort of your home or your street. The 31st of October, it's a walk in all 9 provinces.
Wow. Okay. Thank you very much, Mam Lillian. We will diarize that date indeed. Mama, may God keep you for us. We wish you many, many, many more years. It's not your birthday today, but we wish you many more years so that you can keep on educating our communities and save more lives. Thank you to the support team. Thank you to our viewers. Thank you for your comments. We really appreciate, and thank you for tuning in. Thank you to Ntaga and Sipho and the team. I saw the chief of staff was also here. Everybody, and also to Doc's support team, Bonwabisa, and all other members of the support team. Thank you very much. We really appreciate you. Have a good evening. This was indeed the best topic, one of the best topics. Thank you very much.
Thank you.
Thank you, Madam Speaker. Thank you very much. Bye-bye, all.
Thank you, Madam Speaker. Thank you.
Thank you to Zodwa Qazi as well for your comments, and all the councillors who have tuned in on live streaming. Thank you.